When I came to London to work at St Thomas's Hospital, I was living in Westminster, and each morning I'd walk across the bridge to St Thomas's. And after a few weeks, I realized that I was having some irritation in my airways. I was coughing more and wondered what was the cause of that.
Meet Professor Frank Kelly, who's been working to make London's air cleaner for more than 20 years. His tireless work cements him as a local hero in London, even earning him a spot on the King's New Year Honours List.
When we started linking the air quality data which we were generating to the hospital statistics, for example, the frequency of children that were having asthma attacks when pollution was bad in the city, that really made it very important for me to investigate ways in which we could A, improve the air quality, and B, minimize the health effects.
Over the last 2 decades, Transport for London and Greater London Authority have worked with Kelly's team on producing the data needed to see where air pollution is coming from and what can be done about it.
Through what we call air quality modeling, we were able to show them that if they changed certain types of public transport, the diesel buses, for example, and replace those with hybrids or electric vehicles, that they would be able to improve the air quality by a certain percent. And of course, they could then go and work out what the cost of that would be, and we would be able to compare that against the economic benefit of having less people going into hospital and requiring medications, etc. So giving the policymakers that level of confidence in bringing in a new policy, which would, in many cases, affect people's lives.
Not only would this likely be able to save the city money, but it could help put a lot of Londoners' minds at ease.
So the modern pollution, the particles and the gases like nitrogen dioxide are generally invisible to the eye. So you really need to bring that invisible issue visible to people. And I think Londoners now have been exposed to a lot of information through the media over the recent years. It's covered obviously in the newspapers. It's on the front of newspapers if the pollution's really bad, because we have this great understanding that it's not good for health. So in general, I think one of the last surveys that was done a few years ago, it was in the top 10 of worries of Londoners. So I think, yeah, it's something which, especially if you have a family and you've got young children, you worry more about it.
Kelly's team looks to other cities in Europe for inspiration on ways to mitigate pollution caused by vehicles and public transport, and says London still has a ways to go. First, he says the capital needs to create a public transport system that is mostly electric and help commuters feel less of a need to ride in a car.
And when we do that, then we can look at our road networks, especially within the intercity, and instead of having these pavements crammed with people and vehicles running either side of them in the middle of the road, that you have a nice paved street that people can walk about at their leisure, not worry about breathing in the traffic fumes.
Kelly's work in collecting and analyzing air quality data has landed him the title of CBE. He was named on the King's New Year Honours List for 2025 for services to air pollution research and human health.
It certainly means a lot to me because it indicates that what we've been doing for the last 30 years, which we celebrated last year in existence, that we've actually made a difference. We made a difference to the impact of the environment here on people's lives and on their health.
Now we hope the City of London can implement Kelly's findings and make London air safer to breathe for everyone. In the capital, for London TV, I'm Kate Medeiros.